Hi, Dr. Ravi here, and today we're going to talk about your general health and COVID-19. There's a lot of talk out there. COVID-19 affects people with chronic illnesses, diabetes, high blood pressure, heart failure, liver disease, and it affects people who are older more severely. We know the mortality rates go up exponentially above the age of 70. This is no surprise. This is health. This is what happens with so many things. When people get influenza during the flu season, who gets it? The same people. When people get pneumococcal pneumonia, the same people. People who die of heart attacks. So there's nothing surprising about this. There's some unusual things about COVID-19 and things like the clotting, the severe inflammation, very, very unusual manifestations. But who's getting it? Well, that should not come as a surprise. So what I'm about to tell you should not come as a surprise either. Take care of yourselves. So if you have diabetes, check your sugar. See your primary care doctor. Check your A1C. Monitor carbohydrate content, especially around heavy meals. The ABCs of care become very important. The worse that control of diabetes, the greater the risk of contracting coronavirus. So there are many great strategies that your primary care doctor will know to control this. If you have high blood pressure, ditto, control it. Get it checked. If you're on medications, take the medicines. Watch the salt content. These are basic healthcare tenets, and a good primary care doctor can monitor and can follow, and these can reduce the risk. The same can be said for weight management, obesity, which in turn leads to high blood pressure and these other concerns, can be managed. A lot of talk out there about vitamins. What should I do with my vitamin D? What should I do with vitamin C? Should I be taking other supplements? Certainly take them to stay healthy. A balanced diet. Taking too much vitamin D actually carries toxicity. But taking it as a supplement with the recommended supplementary doses, which are right there in the bottle, absolutely. If you can get outdoors and catch some sun every day, maybe a walk, keeping the social distance, maybe trying a mask. It is hard to walk long distances with a mask, but there's nothing wrong with that. You get a little bit of sun, it helps with the vitamin D. But there's no cure, there's no silver bullet with these things for COVID-19. It's a virus. It does not have a medical treatment at the moment. But staying healthy and reducing your vulnerability for some of these things certainly can make things a lot better. Getting adequate amounts of sleep at night. There is some evidence that active infection with COVID-19 virus can affect sleep patterns, has neuropsychiatric problems, etc. But if you're trying to prevent it, a good night's rest, getting a good amount of exercise is a great thing to do. Now, it may be tricky to go outdoors and get the kind of exercise you want, but doing certain calisthenic type exercises in the house, not a bad idea. Just going for a walk, even indoors or around the property, not a bad idea. So stay active, eat well, and control underlying chronic conditions with the help of a primary care physician who can help and guide you through some of these things. So healthy living is probably the best way to reduce your risk of exposure and infection with COVID-19.